Okay, we are live. I'm Jackie. I'm one of the veterinary technicians at the San Antonio Zoo's Animal Health Center. So this is our hospital where we take care of a lot of our animals when they have medical issues. And I'm going to give you a tour of our hospital. We'll look at the treatment room, the surgery room, the lab, and the pharmacy. So this is a very behind the scenes area, so I'm really excited to get to talk to you guys about stuff that I don't always get to talk about. And just a little bit about our health center. We currently have 2 veterinarians, 3 veterinary technicians, a hospital manager, an administrative assistant, and 2 hospital keepers. So we have a pretty big staff up in this little building. This whole section where I'm standing forward is our newest addition. It's about a year and a half old, I want to say now. And so we got a new surgical suite, a new laboratory, and a new pharmacy. And all of that is because of donations and ticket sales and merchandise. Like, all of that comes here. So you'll see firsthand where your money is actually going, or part of it is going. So I'm going to take you to the treatment room first. And I have lots of fun stuff to tell you. I'm really excited. And I know I have some vet tech schools watching right now, so hey, you guys. So I'll try and throw in some technical stuff too. That would be really exciting to know how it's different from SWAT animal practices. So this is our treatment room. This is where the magic happens. So most of our animals will come up to this room, and we do annual health exams. We treat injuries, illnesses. Some animals, we can just hold them in hand and take care of them. Some animals, we have to fully anesthetize for safety for us and or safety for them, also depending on their condition. So I was going to start with radiology. So we have digital radiology, and this is a newly upgraded system, which we really needed. So the images are much crisper, they're higher quality, and so we can treat our animals much better, and better diagnostics. And so this is a picture of a chameleon. So cat and dog, a lot of times you'll hold the animal down on the table, and we will too. Birds, we can do them awake, we hold them down on the plate, we take their picture, and then we're done. Or if we anesthetize them, but sometimes less restraint is better. So this chameleon, for example, I just put him on the end of a stick, which is very natural for him, and he wants to just grab on a thing, and he just stood still and got his picture taken. It was awesome. And this photo is of one of our elephants, Nicole. You saw her on Lucky's birthday putting a flower on her head, and she's very cute. And so all of our elephants get daily exams, and then periodically we will x-ray all their feet. So elephant foot health is very important because it's a lot of weight on 4 little feet. And so we also have a portable radiograph unit, so we can take it down there because obviously we can't bring her up here. And so we can take pictures of their feet, make sure everything's going okay. And and they're very cooperative, which is really nice. We also have a ultrasound unit, so we can do abdominal ultrasound, echocardiogram, check what's going on in the inside, stuff that might not pick up on x-ray. And then I'm just going to take you around the room and just show you everything. This is our wet table. So in private practice, this would usually be used for dentals. So everybody, when they get their teeth clean, because it's really wet and messy, or abscesses, if we have to flush nasty wounds, like anything wet and gross that gets down here. We previously used this table on one of our colobus. He had some constipation issues, so he needed an enema, and so this table was a godsend, as you can imagine. And it also has a built-in scale, so this is a very handy little table. And then we also have a dental machine. So just like cats and dogs, we clean their teeth. This is just a normal unit you would find in any vet clinic. Nothing special or fancy about it. We have the scaler, the polisher, the drill if we need to. Everybody gets great oral care here as well. And I just have another x-ray pulled up. This is pretty cool. So this is one of our mud turtles, and you saw a video on them previously from the Conservation Center. And so I'm just going to show you an x-ray. So it's a really cool turtle, and you can see his head is tucked in and all his arms and legs are tucked in. So we were basically just doing a scan of, how they were doing since they, went through what they went through. And I wanted to point out right here, this in the x-ray is a microchip, just like you would do in a cat and a dog. A lot of our animals here get microchipped because we can't always tell them apart. And so if we have any issues and we need to treat anybody, we can tell who it is, and we can look back at their record and find out exactly what they've been through. And then if you want to come over to the treatment table, I have some fun stuff to show you guys. So here's our little 8 friends. And I was just going to show you how when we anesthetize our animals, they get the full works. So we have all the monitoring equipment. We have a little pulse ox clip on his ear, so this checks for a heart rate and their oxygen saturation. They get their blood pressure checked, and then we have EKG clips that hook on just like people and animals in the vet clinic. And so we keep track of their heart rate, and we can read an EKG. And then I was going to also show you some face masks. So I'm going to say cat and dog clinic a lot, but it's just how we compare everything. So in a vet clinic, like a small animal practice, this would be a normal face mask for anesthesia. So this just goes over the face, and then you can blow the oxygen and the gas so that they'll go to sleep. And so they don't make these for tigers or storks or tiny birds or like weird face-shaped animals. So sometimes we have to make up our own, and we get to repurpose items. So this is just a 2-liter soda bottle that works great for like a long-beaked bird, and you can just hook up your anesthesia tubing here and put it on its little face. And then kind of the same thing with this used IV bag. And so this is really good for storks and flamingos, and I actually have a really cool picture here of it actually in use with one of our wattled cranes. You can see it just goes over the face, so then they can get the oxygen and the gas, and then they go to sleep. And then I have a little tiny mask. So this would be for like a little bird or maybe a duck, and it's made out of an old syringe case. So repurposing, reusing. And then this is what we would use for like a lion or a tiger or maybe one of our bears, and it's just an old milk jug. I've put a little padding in there with some Gorilla Tape, and then stick it on their face and they go to sleep. And then, so we have also intubation. So you've probably seen these on like Grey's Anatomy and maybe Animal Planet. So when we anesthetize an animal, we intubate them. This is an endotracheal tube, so it goes down the windpipe. And this is how we keep the gas anesthesia flowing and their oxygen, and we can breathe for them if they need that. And so you just blow up the cuff with some air, and that gives you a nice seal. So there's no leakage. And this is a 7.5 size, so 7.5 millimeter. Which is about the average size you would use on a human, or maybe a goat, or a larger primate. And so this is what we would use for like a tiny little bird, like maybe a small dove or a finch. So such a drastic size. We have to be so flexible in what we do here. And then I just wanted to show you the drastic difference. This guy is what we would use for maybe an elephant or a bull giraffe, so much bigger. So you can see how specialized we are here. There's nothing that is really one size fits all. So I always like showing that off. It's pretty impressive. And then let's see, what else do I have? Oh, so here's a picture of our clouded leopard in Zira. You saw her in one of the Cat Grotto videos. And that's her getting intubated, just like the trach tube that I showed you. And so, like I said, everybody that comes up here, they get the works. We don't shortchange anybody. Everybody's fully monitored, and we have, like in this picture, this, who is this? This is Ando, our caracal. You also saw him in the Cat Grotto, and so he's getting his teeth cleaned, so full dental scaling. He is on all his monitoring equipment. He's currently getting ultrasounded, and so he's getting his full annual workup. Nothing unhealthy about him. He was just getting his vaccinations and his annual x-rays and all that good stuff. And then this, I was going to show you something fun. So this, I'm calling her Phoebe. She's my dog's toy. And so this is our little turtle friend. And I was just going to show you something cool. So since on our little ape here, I was showing you how different ways we can get a heart rate with the clips or the little pulse ox clip on the ear. In a turtle, we can't really do that. So we use this little machine called a Doppler. And it is just this little probe. And just put a little lubricant on it. And then you can put it in here or up under here where the skin is showing through the shell. Our typical spots that you would do heart rates on a turtle. Also works for reptiles, so like up on the clavicle, up under like the armpits. And I was going to show you on myself what it sounds like. So you just have to go over the pulse. Hopefully my heart rate's not too fast right now. It's a little fast. So if you can hear that swish, 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 that's the heart rate. And then we would just count that like as if you were listening with a stethoscope. So we have all kinds of fun toys here. Oh, and if you were doing a bird and you can't get your little pulse ox clip to work, we have a different Doppler probe that's a flat one, and you can put it over the artery in the ulna of the wing, and then we use tongue depressors with tape, and we just make a little clip, and it holds it in place. And so you don't have to like hold it there or check it like every 10 seconds or so. You can just hold it in place like that. So fun toys that we have here, ways that we work around things. We can go into the surgery room. So this is the new addition to the hospital. Watch out for this one. She's a clever girl. So this is brand new. We have nice surgical lights, which we didn't have before. And we have a separate fluid warmer in here. We have our monitoring equipment, anesthesia machine. We have a ventilator. And also in here we have capabilities of doing endoscopy. So if we need to scope anyone, either we have like rigid scopes and flexible scopes. You can go down the throat or like straight into the abdomen. And we also have a cautery unit. So if we need to maybe make an incision or like burn off a little growth or something, this machine will do the trick. And I have our little armadillo friend here. And I'm just going to talk about some of the stuff that we've used our surgery room for since we got it. Because we're so happy to have a separate surgery room. We used to do everything in the treatment room, which isn't the best. It's nice to have like a nice sterile surgery room. And so we had one of our little armadillos. She had surgery. She just had a little mass near her bladder, and she's doing great now. But you can see she's intubated just like everybody else. She has a little pulse ox clip on her foot. And we had placed an IV catheter in her little tiny leg. I'm pretty proud of that catheter, actually. But yeah, she's doing great. And then here's another thing we did in this room. So this is one of our large pythons. And she had a mass in her mouth, so an oral mass. So we have this cool little contraption to hold her mouth open. You can see we padded it where it would be placed against her mouth so we don't injure her. And so we could hold her mouth open safely during surgery, and we removed the mass, and she's also doing great. So yeah, lots of good stuff here. Does anybody have any questions? Not so far? Okay. I talk a lot, so feel free to stop me. We can go to the lab next. And I'm a total lab nerd, so I'm trying not to get too technical. But we have capabilities of doing a lot of laboratory stuff in-house. So we don't always have to send out to a lab because that's what our veterinary technicians are for. That's why we're really good at our job, because we can do all these things in all different species. But we do have some in-house equipment, so we can run chemistries on blood. We have a machine that will run urine analysis. If for whatever reason we didn't trust the results or the machine was down, we can also do it manually. Let's see, what else do we have? Blood. Okay, blood is my favorite, so I'm going to talk a lot about blood. So we do a lot of hematology here, and mammals versus birds versus reptiles are all very different. So we have a lot of training that we go through to properly analyze all of the samples. And I have a slide up on the monitor here if you want to look. So this is a slide of one of our lions. And as you can see, all of these, here I'll show you, all of these are red blood cells. And this, for the vet techs watching, this is just like a normal cat's. Like all their blood is pretty much exactly the same. And then we have white blood cells in here. So they'll indicate any inflammation or infection. And all these little tiny purple dots are platelets. And they indicate that they're clotting well and properly. And then I can show you the difference between a mammal and a bird, because they're vastly different. Okay, so I have up on the screen, you can see how different it is. So this is a flamingo, and these are the red blood cells. So the big difference is birds and reptiles have nucleated red blood cells. They have a nucleus in each red blood cell. And automated machines can't read these. So that's why we have to do the birds and reptiles manually, and fish and amphibians. And then this is a white blood cell. There's not a whole lot on this slide. And then they have platelets, just like mammals too. So we have to know the variances between birds, reptiles, mammals, fish, amphibians, and even between each species. So like a flamingo versus a pheasant versus a penguin, like they can all be, very different from each other. Okay, so I'm going to show you my books real quick. So these are some of my go-to lab books. Not that I work for these guys or anybody, but so this one is on exotics. It's hematology and cytology. So it goes through like all the different species, and so it'll help you if you're learning how to do hematology and cytology on exotics. This is a really good reference book. And just to show you how specified they can be, this book is just on bird hematology because they can just be so different from each other. So this is like my little bird blood Bible. So we had a couple of questions about intubating. So what animal has been the most difficult to intubate? For me, I would say probably rodents or animals with, they can't open their mouths very far. So normally you can just open their mouth real wide and then you can pass the endotracheal tube. But some animals like wallabies, guinea pigs, which you'll see in private practice, animals like those, it's hard to, you can't open their mouth very far, so it's harder to visualize what you're doing, so a lot of times you just have to kind of almost blindly do it. You can listen to the tube as you pass it to hear if you're hearing breaths, or we have a really cool little scope that will fit down the tube and you can actually watch as you're going down, which that's pretty fun. Yeah. Do you have another question?
Do other zoos ask for assistance?
Zoo vet techs generally, we have a forum that we all are pretty much a part of. If you're part of, so AZVT is the Association of Zoo Veterinary Technicians, if you're interested in learning about that. We have a forum that we keep up with, and we bounce ideas off of each other, ask for help, like, hey, have you ever seen this condition in a porcupine? And everyone's like, no, I've never heard of that. And then this one person's like, yes, I saw this one time and this is what we did. And we're like, great, we'll try that. So a lot of zoo medicine is, oh, I've never seen this before, or I've never done that before, or is there a way to do this? So we do rely on our colleagues in other facilities to help us out too. Yeah. Oh, parasites, yes, okay, poop. So everybody poops. So we deal with a lot of fecal samples in the zoo, and so animals will get routine fecal samples examined, or if they're not feeling well, or if they're having GI issues, vomiting, diarrhea, constipation, anything like that, or just, maybe they see blood in the stools or see an actual parasite, so they'll bring the sample to us and we analyze it. We look at it directly under the microscope, and then we spin some of it down, and let the eggs float up, and we can look at it under the microscope, and we look mostly for eggs, but sometimes for larvae also if they pop up. And so that's one of the things I like about being a veterinary technician is we can't diagnose anything, but we can have a direct impact on the animal's care based on our findings. So it's really important that we know what we're doing and that we're properly identifying, blood cells, parasites, cytology samples, all that kind of stuff, because what we find can decide on how we'll move forward with the animal's care if they're ill or unwell.
Kat wants to know, how many people does it take to do a full procedure on a large animal or dangerous animal like bears or lions?
Okay, so a lot. So it depends on what we're doing. So if we have to bring them up to the health center, we need lifting bodies. So, they weigh maybe 400 pounds or so. So it takes a lot of people to safely lift them, get them into the vehicle. We bring them up here, we get them up on the table. But usually we'll have a veterinarian running the procedure, and then we'll have a veterinary technician purely running anesthesia, and then another veterinary technician running the rest of the procedure. So they're maybe getting the blood, getting the x-rays, giving IV fluids and whatnot. And then we have the keepers, which are just as important. So they'll help us, if we need to manipulate the animal, like maybe lift a large leg up, they're pretty heavy, or help looking in the mouth, and they'll help us with their equipment. So they've been doing a lot of this along with us, so they know oh, when I say this, we need to do this, and they're usually a step ahead of us half the time, which is really awesome. So yeah, it takes a lot of people with the big guys, mostly just because it's so much weight if we need to move them or get around them. So, but we also want to be safe, so we try not to have too many people directly with the animal at a time. So should something, if the animal gets a little bit light or something, or we have to get out really fast, but we're really good at anesthesia, and that's our job, so we haven't had any close calls, luckily.
Besides regular veterinary courses, is there anything special you have to do or courses you have to take to become a veterinarian with these types of animals?
A veterinarian?
Or vet tech?
A vet tech. So generally, and it depends on your states, generally to be a zoo tech, you should be licensed with at least associate's degrees. Some zoos will require a bachelor's degree. It's a competitive field, so there aren't really a whole lot of us. So the more volunteer positions you can get with exotics or zoo, or even working in a private practice that sees exotics, any externships that you can get in a zoo will help you get ahead, definitely, because it can be hard to get into a zoo.
Do veterinary staff ever assist animal care specialists in any kind of types of training?
Yes, we do. We do a lot of training, which is really awesome. I like that the San Antonio Zoo is really proactive with medical training on our animals. So for example, our lions are trained, some of our lions are trained to collect blood from their tails. So instead of having to completely immobilize a lion just to get a quick sample for a routine exam, or maybe they're just not feeling well, they will voluntarily sit, and we have a cool little trap door that we can present their tail through. So they'll give us their tail, and we just get blood, and they're just getting whipped cream the whole time, so they think it's great. And but one of our lions, so if you've been to the zoo, Sarabi, she's our oldest female lion, and she doesn't have a tail. So we're like, well, crap, how are we going to get blood from this lion? And so we decided to go with a blood sleeve, which is commonly used in great apes and bears. And so we actually trained her. Our maintenance team made a cool mesh arm sleeve for her front leg. It's a leg. So her keepers trained her to present her leg in the sleeve, and she just holds onto a pole, and then we can go in and just get her blood sample, and this is awesome. And then, but not just blood stuff, so also injections. So if we can vaccinate them without having to anesthetize them, that's way better for them. And um, or even for anesthetizing them. So like right now I'm working with one of our male gibbons, Mel. He's a fan favorite here, so everybody probably knows Mel. We've had a very complicated relationship, but I think we're just about BFFs now. And so we're treating him for an injection so that we can anesthetize him to get his annual exam. And it's less stressful than, say, sometimes we have to use like a dart that has the anesthetic injection, so we can dart them the medication and they go to sleep. But sometimes it can be stressful on the animal, and so if we can hand inject them, they're calm, they're not all worked up, they're not scared of, the dart, because they know what it is. And so then we can use less drug, so that's better for the animal, and they're less stressed, they won't burn it off, and their temperature won't be up. Like some animals can get hyperthermic rather quickly just from being so like worked up. And so we can train them to just take a little hand injection, and they're like, oh, what? And I get a treat, and then they go to sleep, and it's so much better for them.
So dogs and cats have allergies and stuff like that. Do our animals here at the zoo have kind of the same medications that you give to dogs and cats, or what kind of illnesses would they have similar to household pets that you see?
Yes. So we're in Texas, so almost everyone has allergies. But we do have some animals in our collection that are on allergy medications or allergy injections. Again, they're trained to receive the injections. But they can be allergic to mold and hay and sometimes dairy, and so we have to adjust their diets also. So we also collect blood samples and test what they're allergic to, so then we know what to take out of their diet or their environment. But medications generally, yes, we have a lot of medications that we utilize. So antibiotics, antifungals, dewormers, birth control, all kinds of medications. Same stuff you would see in a small animal clinic, yeah. But we also have many presentations. So we have tablets, powder, liquid. Not everybody will take a tablet, not everyone will take a liquid, and the keepers also have to get really creative and also have that close relationship with their animals, that they'll trust what they're giving them is not like tainted or anything scary. And we can also flavor medications, so we do some compounding here. So if we need to make something that only comes in a tablet and we need to make it a liquid, because this animal will only take a liquid, so we can compound it, we grind down the tablet, make it into a liquid, and then we can add flavoring. We have grape flavoring, tuna steak flavoring, bacon flavor, like whatever they like, peanut butter. So we can cater to their taste buds if we need to.
Have you ever participated in any vet work or studies for animals out in the wild?
I have, yes. So I've done work in several different zoos before here, and also I've gone and done conservation work out in other countries. So I've done health exams on Jamaican iguanas at their Head Start facility. I participated in a study on Turks and Caicos iguanas. It was like a relocation and stress indicator study. And then I've been to Indonesia and Borneo and worked with orangutans and sun bears. Orangutans are where my heart is. I really love the great apes, and especially orangutans. So in Indonesia and Borneo, working with them really opened my eyes, because I got to see firsthand, illegal pet trade, deforestation, their loss of habitat, human-animal conflict. So we would see animals that would get shot with pellets because they got on the farmland, and the people, they need to protect their farmland, but they're losing their habitat, and it's there's a lot of conflict over that. So these rehabilitation centers will take them in. They get a lot of babies that were taken as illegal pets, and they get confiscated, and so they have to learn how to be an orangutan before they can be released. So yeah, I've done a lot of conservation work, which I really love. But yeah, it's been very eye-opening for sure. Yeah, okay. Any other questions? Okay. Oh, I was just going to say, um, so for the other vet techs that are watching also, um, and people that aren't in veterinary medicine at all, I was just going to kind of explain, which I meant to do in the beginning, like what vet techs really are. So, um, some people like to refer to us as a veterinary nurse, which is accurate. Like, yes, nursing care is part of our job, but we actually do a lot more. So, we're also like anesthetists, we're laboratory technicians, we're radiology technicians, we're dental hygienists, physical therapists. Like, veterinary technician, that term just encompasses so much into what we do, um, and having to do it with such a wide variety of species, it's really specialized, and we go through a lot of training to learn how to work with all these different type of animals. And like I said, every day, like, I'm learning, like, oh wow, I've never seen, this condition in this type of animal. And so, I still get to learn, like, oh, that's, really interesting. And so we're just constantly learning, and I love it so much. I'm really proud of my career, and if anybody is interested in zoo medicine, like, I really highly recommend, um, looking into it and going for it, because I've done things here that I just think is the coolest, and to be able to one-on-one take care of these animals is just like, it's a dream job. It really is. And I'm really appreciative of the San Antonio Zoo for taking me in. And I appreciate my job every day, and appreciate everybody that donates and comes to the zoo and buys tickets and merchandise and like contributes to the animals' care. So thank you guys for all of that. So yeah, thanks for listening. Ask questions. I can try and answer later, if that's okay. If anybody has extra questions, I can, answer those later. So thanks for listening.